So there only might be fewer options, not because of a chronological age, but because of the fact that skin elasticity decreases over our entire lifetimes, and more so with certain things like weight fluctuation, disease states, smoking, sun exposure. So there may be more of that sort of stuff that is cumulative over a person's lifetime. And so you might have less elasticity, and therefore you may have less options available to you that depend on elasticity. Things like the keyhole procedure or the periareolar procedure might be less likely. But apart from that, we actually don't, for elective surgeries of these types, we don't think of people in terms of chronologic age. We think of people in terms of medical complexity. You can certainly have very healthy 60 and 70-year-olds and beyond who are low surgical risk because they have such physiologic reserve from being such healthy people. You also could have people that are 30 or 40 years old who are very fragile and don't have a lot of physiologic reserve, and we have to think about whether or not an elective surgery is right for them. So we think of patients in our assessments in terms of their overall medical wellness and medical complexity. And then we make decisions along with experts, such as the primary care physician, such as specialists like cardiologists and others, and even also with anesthesiologists to really decide whether surgery is right for somebody. But rarely is age thought of as an independent variable, except perhaps in kind of the really significant extremes, like maybe 80s, upper 80s into the 90s. I think people would realize that most individuals in those ages have a fairly limited physiologic reserve, and so we need to think about that very carefully. But most people that are well into their adulthood, I don't think we're thinking about the age as a problem. We're just thinking about the skin elasticity, which might be affected a bit by that age.